Congressman Jim Jordan is with us, Republican, Ohio. Congressman, welcome to the program. This is a very big day, and we're trying to work out what happens in the future. As we understand it, and I hope you can confirm this, Republicans want to have a bill on President Trump's desk by February the 20th, which will repeal Obamacare. There will then be an orderly transition to a new system. Are you convinced that nobody is going to be left high and dry without any coverage at all?
Well, yeah, that's exactly the plan, Stuart. Remember, I think, as President-elect Pence said, as the Speaker said, I think health care will be better and less expensive when Obamacare is gone. All you have to do is look what's happened the last 5 years. Everything they said about the bill turned out to be inaccurate. Like your plan, keep your plan. Like your doctor, keep your doctor. Premiums will go down. They'll go down on average $2,500. They told us the website would work, the website's secure. All the things they told us turned out to be false. So healthcare will be better and less expensive when it's gone. So repeal it and then replace it. But here's the key from my point of view. You can't take all day about replacing it. It should definitely happen this Congress. This idea that we may take several years to do that, I don't think the American people will tolerate that. We shouldn't do that. That's not what we told them we would do. So yeah, we need an orderly transition, but it needs to be done as quickly as possible because we know how bad Obamacare has been for families and for our overall economy.
Congressman, it seems to us that the key here is the mandate, which is part of Obamacare. Yeah. You've got to have coverage, and it's got to be this coverage. If the repeal bill on February the 20th gets rid of the mandate, you've essentially, right there and then, you've changed everything.
Yeah, you've changed everything. You get rid of the taxes, you get rid of the mandate, you get rid of, I would like when we put together the replacement approach, it'd be market-oriented, it'd be patient-oriented. Think about what we have now. We have Obamacare, which is Washington-focused, Washington-centered. Everyone knows that hasn't worked. Let's get back to patient-centered, family-centered, doctor-centered. Let's get back to a marketplace model, one that empowers the consumer, empowers the patients and families who are making the healthcare decisions. Let's get back to that kind of model. That's what we have to. That's why you heard Vice President-elect Pence talk about medical savings accounts, health savings accounts. You heard him talk about purchasing insurance across state lines. Market-oriented approaches that empower the individual. That's what we have to focus on. If you do that, that will be the orderly transition that I think the Speaker's talking about. But let's do that sooner rather than later.
There is one thing which seems to be very popular from Obamacare, which a lot of people want to keep, and that would be that you have your children up to the age 26 included on your health insurance policy. You think that's likely to stay?
Yeah, but do you need a mandate to do that? I think the marketplace, if that's popular amongst the consumers, I think that's likely to develop in a marketplace. Of course, we're for that, but I don't know that you necessarily need the government to say you have to do that. We'll see how that plays out. Those are some of the things I think will be part of the debate and discussion as we move forward. All I'm saying is let's do this as quickly as possible. After all, that's what we told the voters we were going to do, and that's what they elected us to do.
It must be some pretty intense discussion that's going on right now among Republicans.
It's starting.
Yeah, this must be intense because you've got to figure out what to do with 15% of the American economy when you've repealed the Obamacare law. This is a very big deal. It's going to be very difficult to get a replacement in place relatively quickly, surely.
Yeah, but always start from the premise that I mentioned just a few minutes ago. This has driven up the cost and provided worse care for the people who are the entire healthcare system. So I start from that fundamental premise. Healthcare will be better. It will cost less when we move away from Obamacare, when we get rid of Obamacare, when we repeal Obamacare and move to a more patient-centered model. That is the premise. So when you start from there, I think that gets you on the right track to doing what needs to be done. And again, what we promised the voters we would do when they elected us just a couple months ago.
Okay. Congressman Jim Jordan, look, thanks very much for taking time out. I know you've got a very, very busy day. We appreciate you being with us, sir.
Thank you. Thanks, Stuart.
Yes, sir. Katie Pavlich.